Okay, so I really appreciate you guys coming over tonight and spend the evening. Hopefully, we're going to be discussing the exciting topic about Kybella. So let's talk about what is the Kybella. It's such a new entity and just started last year. So let me kind of explain to you what is it. So it's more of casual discussion. I just want to give you the most updated medical information. If you look at yourself in the mirror or the pictures, have you been bothered by your double chin? And does it really make you kind of look old and overweight? Okay, don't feel bad, you're not alone. In the population, 60% of the consumers that we have in America feel the same way. So you're not alone, okay? Now, so what is it? What caused the double chin? Let me kind of explain to you a little bit more detail. Genetic. You probably see some young folks, I'm very slim, exercise, you go to gym, some have double chin. It's not they're overweight, they're not old, so it's not aging issue, it's a genetic. Unfortunately, that's in the gene. If you ask them detail, they'll tell you, oh yeah, my grandmother has this, my grandfather has this, and it is the gene factor. And of course, weight gain, you gain everywhere. Of course, the double chin comes back too. The aging is inevitable. We're all going to go through that, but I like to go through gracefully so we don't show too much. And that's where I'm going to help you kind of preventively work with that. So you can tell it's no ethnic group excluded. It affects every races, age, which we all know. And unfortunately, we all have that look if you come to the aging like we are with the menopause or the andropause. So what is the Kybella? It is only FDA-approved treatment in the United States that can improve. We call them moderate to severe. This is called submental fullness, okay? Instead double chin. Medical terms sound better. And it is medically derived called deoxycholic acid. So what is this deoxycholic acid? It is natural occurring molecule in the stomach. So think, when you eat food, French fry, hamburgers, all the fatty food that we have, who helps us to digest the fat? The enzymes, right? And the derivative of this pure molecule, we're coming in, have a seat. And you made it, good. Yeah, right here, front seat. And it's the deoxycholic acid. So it's a natural substance, right? So in the gut, it helps us digest the fat. It breaks down the fat molecule and lyses and breaks down to amino acid, and we absorb back to the body. That's natural occurrence. So science is very smart. They know that's the natural occurrence substance. That's how our body breaks the fat. They're able to extrapolate that molecule and purify it in the laboratory and put it in use in this Kybella. So what we do is a purified molecule, so it's not like you have additive stuff, you have mixed structure. No, it's a pure Kybella. There's no preservative in the substance. There's no any other like lidocaine chemical in this. It's pure molecule in a syringe form, of course. I will specifically isolate the area, which I'm going to tell you where, and I put it right in where I needed to. They destroy the fat very selectively. So it's not doing randomly, it's not doing injection through the venous system. No, it's a specific anatomical area. So what it does, once you break the fat cells, it lyses. I'm going to show you the picture. So it doesn't accumulate. So it's not like, hey, doc, I'm doing injections here. Am I coming back with additional, say, 2-3 years later when you gain fat? No, because you know what? The cells being destroyed. They're no longer there. So it's not going to be accumulating again. So this type of procedure is really permanent. Once it's gone, it's gone. Now, this is nice. I like pictures, so I like to show you. This is typical what you see on the skin, okay? Surface skin. They have subcutaneous, all the blood vessels, and this is the fat. And I'm specifically targeting this double chin called submental fat. They anatomically are identified anatomy, then we collect right there, and the injection very specifically to this area. So if you diagrammatically magnify the picture, that's a fat cell. So once injection in there, this fat cell, what happened? Breaks, lyses out, so the fat molecule comes out, right? Then the cell dies, they disappear. That's where the fat look disappear in the area. And all those molecule breaks down, becomes the body had the response we call inflammatory response. What they do, they clean up the field, right? So that's where you have a inflammatory response. Then they absorb, which I'll show you step by step how that's going to affect you. So clinically, they've done a study on the population. 79% of the patients treated with the Kybella, they have very satisfactory results. You see them disappearing, nice curvature in 12 weeks. Okay, so it's not I inject today, you see looking good tomorrow. It doesn't. There's a process. Let me explain to you how that process takes. Okay, then another thing I want to throw that in is people will ask me, Doc, how many treatments do I need? It really depends how much fat you have, how big area is involved, and also your personal goal. Some people want to reach sharp angle. You see improvement after each treatment. They can tell what's your end point. On average, we just talk about average between 2 to 6 treatments. And usually we do every 6 weeks for a reason, because I want all the inflammatory response to clear. So you will see the results before the treatment, after one treatment. You see the curve angle after 2 treatments, then really sharp angle after treatments. That's why its end point is how much you want to get to and how sharp you want to be. Okay, now, it is office procedure and usually can be done within 15 to 20 minutes. What I usually do is I like to have pain-free procedure, all the time for my cosmetics. So I do have to numb you 30 minutes. And after that, I do want ice before, because, when you put ice on it, you numb the nerve, right? Then after that, I mark area, which I will. That's why, so it's not just randomly poke. I identify the anatomy first. There's a grit mark I put on it. Then I can count how many dots that you have. Each dots, I know how much you put in. So it's very scientifically based, so it's not just random shot. Then after I finish, immediately I put ice pack on, because inflammatory response takes that effect. Once in, they start working. The cells start breaking off, so we start noticing the swelling. But I recommend chin strap, because you don't want swelling show it up too much. You strap them up, give the definition. The longer you can wear the strap will be better. Do it at night for sure. So let me talk about each one of them, how that works, so I can walk you through this microscopically. When I inject, remember, anatomy is critical. So the major areas I do not touch it. We call them no-fly zone. Okay, major artery, nerve, not on here. Just right on the submental. So identify your anatomy, so I know what areas is safe to do. Then I have grit mark, which Allergan company, thank you Jeff from Allergan's can support, and I mark those areas with count the dots. So before the procedure, I pretty much will tell you how many syringes you needed. Each dot is how much cc I'm going to put in. It's very scientifically mapped out. Then after that, we clean you up. Of course, clean the scrub, make sure it's all sterile clean. Then we inject each dot. So what happens when I do it very systematically, I put everything down. The reaction takes immediate, right? I already got it in the fat. It's already taking effect. It breaks down. What happened when the fat lyses out, the swelling takes effect, right? Just like if you bump into something, you get bruised. Why? Why you get swelling? Because all the inflammatory markers start coming up. Try to clean the field, try to get rid of the debris, so to speak. So you have the inflammatory response. That's immediate, which you see. A day later, oh yeah, you're like really swelled up, which is normal. That's everyone experiencing that, okay? So that tell me it's working. Then ice them down, try to minimize the reaction. That's one. So that's where the swelling comes in. The major arteries there, I'm not going to touch them, but they are microscopic vessels. Sometimes you may get bruises, but again, bruises is temporary. It goes away in a week. I do fillers, so I can tell you they do go away, so it's not permanent. And the pain, because what happened, I'm expanding them, right? I got an injection going there, so there's fluid in the area. There are lyses of the fat cells, so you will get the discomfort, the pain, which is stretching, okay? Then, of course, nerves up there, I'm not touching, but because of swelling, sometimes may feel a little numb, but again, this is all temporary. It's transient, it doesn't last long. The redness that we see. So usually what I would say to patients is first day after acetylene, you look really big, don't have parties, you look like gooseneck, just kind of know that fact. Then about 2 weeks later, people don't know you had it, and you can't even tell. So first week, I would say kind of take it easy. No, don't plan major events because you'll notice swelling. Then second week, it's like, oh, you see it, but you don't really see. People don't see that. So second week looks better. Third week, fourth week's fine. We kind of want to wait it out 6 weeks later until all the inflammatory response clear. Then I know how much is still left, right? Then we can do the second treatment. So each treatment, you see the additive benefit onto the results. So usually we like to see 2 treatments, see how it goes, okay? Then kind of carry you through the 3 months. If you like it, you want a little sharp angle, then we know who's left over. You may not need 2 syringes in the latter part of the course, but initially you probably need to because the amount of dots we're going to see is quite a bit, especially if folks has a lot more fat there, okay? So that's what the microscope takes effect. So right after the procedure, like I said, I'm just summarizing this discomfort. So in that first 5 minutes, I usually hold ice pack on it, kind of freeze the discomfort. We know ice numbs it, so it doesn't feel much. So if you can get through the first 5 to 10 minutes, then the pain, all that stopped, okay? Then when you go home, you feel a little full, but when I notice, like when I do liposuction surgeries in the office, and when I tag them up there with a chin strap, it feels better because I'm holding the tissue up. Because of the inflammatory response, after the first treatment, people notice because it's like first virgin area I'm intervening, so you have the swelling. But on the second treatment, from experience on the patients, it felt much lesser because your body kind of used to what response and also lesser fat. So second treatment is much, much comfortable compared to the first one. And then I talk about the swelling go down. Like first week, you don't plan 2 major parties because the swelling is noticeable. Okay, the skin tightening, that's what I see from other physicians, their experience too. It's like in any of the procedures that we do, if you have inflammatory response, you notice skin is tightening. Okay, like I do lasers, when I have inflammatory response, they get skin taut. Same principle here. In this area, a lot of folks, when they have a lot of fat, they hang, so the skin gets really loose, we call it kind of like a gooseneck. And if you have the inflammatory response, you get tugged up like this. Now, I do have to also put a real perspective to you is this. We know the facelift is like that, right? It's tucked up like that. But this is not going to be like that because it's just a submental fat here. So this region will be tucked up. And when you do that, when I lose the fat, improve the fat, actually the angle of the jawline actually creates, which you will see the pictures. So then we talk about after inflammation's gone, that's the benefit to this procedure, this tightening of the skin. Okay, see, that's what we before. You can see that after it gets a sharper angle because this one is kind of blunted, you can see, but when I lose the fat, you actually see the angle, create the angle much more prettier. Now, men's too, I hate to say, men and women, we're all suffering the same thing. Jawline, sharp angle, and lateral profile. Okay, so if he's happy with it, no problem. If he wants it, we can get sharper angle like the other lady. He probably needs a little touch up. Okay, so then you're going to ask yourself, hey, is this Kybella a choice for me? Is this the right choice? Because there are a lot of options. We know the surgery, we can do liposuction, this procedure surgically. And if this double chin bothered by you very much, think about it. If you don't want a surgery, that's medical procedure, think about it. If this double chin really makes you kind of old, then really your age, then think about it. And if you do exercise, you diet, you do so what, everything looks good except this, think about it. So those are what I call, we have option here that's non-surgical that can achieve the goal we wanted to, and also reaching the, like I said, I do any of the procedures, gently, slowly see where you want it. Instead, cut. So this is the option that we have. Any questions? Yes. Oh, good point. It's coming. You're going to get a huge discount, lose hanging out with the cash, Okay, yes, Rand.
So you said it's just underneath, but it does from the sides because...
Okay. Think of your anatomy. Okay, this is the jawline. Yeah. Okay. Then we got this hyoid bone, which is like an Adam's apple. See, this is called platysmus fat right there. If you would take that off, watch me. If you take this fat off, you get tucked up, right? When tucked up, the jawline improves, so you actually have definition. People, yes, help. Exactly, because people think, oh, look, yeah, it's everything hanging. But if you would take that fat off, you improve. Now, remember this product just came out about a year ago, and it's kind of relatively new, and we only test this spot. That's what Allergan does. It's safest because we don't want people, with this, all that. So I know in the future, knowing the medical field, we always test other spots, right? Eventually, we will do other areas. But right now, for safety reason, I just want to achieve the goal that we want, which is this part. I'm sure, think about it. It breaks down the fat. Duh, we got a lot of unwanted area. I'm sure there will be options that will come, but that's down the pipeline. Okay.